Welcome to Live from Plato's Cave. I am Mario V. This is episode 40, The Climate Health Crisis with Margarita Vossen. I hope you enjoy my interview with Margarita. I recently started a new job, but before my current job I worked in medical education for many years. And towards the end I noticed three ironies of healthcare in relation to the climate crisis. So first of all, the climate crisis is recognized to be the greatest threat to public health. The Lancet last year even said that health is now at the mercy of fossil fuels. But the healthcare industry itself is also a big factor in contributing to climate change and to pollution. For instance, in the Netherlands, 7% of the national CO2 emissions, which is just as big as the aviation industry. So that's quite ironic that healthcare, which is supposed to cure people, also contributes to the greatest threat to public health at this moment. The second irony is that this message of climate science has been heard for decades, and the impact of health is maybe a little bit younger, but we've been hearing it for many years as well. And healthcare practitioners pride themselves in being evidence-based. But in this particular case, they don't follow the science. You could compare it to the 1950s and 1960s when there was evidence for smoking and the relationship between smoking and cancer, but doctors were still smoking. Well, at this moment, there's a lot happening in relation to climate and healthcare, but not even close to saying that they take it as one of the priorities or even the top priority. And the third irony is that, well, from my own experience, I've seen a lot of people taking the lead in relation to climate in the last few years that I was doing this job. But in almost all cases, they were younger than me, or they were even students. And this is ironic because it creates a situation where students are often more knowledgeable and taking more leadership on this important healthcare issue than their teachers. Well, I wrote some articles on this, which I linked in the description, and one article, my co-authors and I outline how the bystander dilemma can explain the lack of evidence-based action in the climate crisis. And there's another in which I argue that climate activism is, or at least could be seen as professional for healthcare practitioners. But let me introduce Margarita Vossen because she is an actual doctor. Margarita Vossen is a medical doctor who has worked in several areas in medicine. And she's worked in the Netherlands, in Zambia, in Lesvos and Moldova. And currently she's working as a general practitioner or family doctor in the south of the Netherlands. She's an ambassador for the Dutch Green Healthcare Alliance, and she's a member of the Green General Practitioner. In this role, she tries to build a more sustainable primary healthcare and to reduce its environmental impacts. She's also part of Extinction Rebellion, specifically in the XR healthcare professional circle.
Good morning, Mario. Thanks for having me.
So we're at the Utrecht Science Park, and you told me that this is a familiar place to you.
Yeah. It was really nice this morning to bike to Utrecht Science Park because this is the place where I studied medicine, and Utrecht is also the place I grew up. So it's been 7.5 years ago since I think I was last here.
Yeah. Did something change?
Well, actually, what I found is the rainbow zebra crossing. I'm pretty sure we didn't have that one when I studied here, so it was good to see some progress.
Yeah.
Yeah.
Why did you decide to study medicine?
I don't really know. I think it was my mom who always said when I grew up as a child, like, oh, you have to find a good job where you are meaningful to people. And maybe you can become a doctor. So growing up, I didn't know anything better than, I'm going to be a doctor. That was my goal in life. And happily, that suits me really well. So I think she she didn't make the choice for me, but she pushed me towards the good direction, which suits me well.
Yeah. I also studied in Utrecht, and to me, studying medicine was always like the example of what I didn't want to do, at least what I heard. Like you have to study extremely hard, long working hours, long education as well, long training as well. but you like to work hard, I think.
Yeah. And I'm a curious person, and I wanted a meaningful job to really help individuals or people in their life. And I thought that becoming a doctor was the right thing to do.
Did you do any specialty in your training?
So the study itself, it's 6 years, and then like 3 years of theory, 3 years of practice, like internships in hospitals and outside of hospitals. But during the study, there's no real specialty.
No.
Yeah, you after 6 years, you're just a doctor, a medical doctor.
Right,
Yeah.
And now you're a general practitioner?
Yeah. Mm-hmm.
And how did that happen? Did you decide that during your education already, or?
Yeah, so I think a lot of people who start the studies, they all think, well, I'm never going to be a family medicine doctor or general practitioner because that's boring. It's only people who have colds, and you just prescribe them paracetamol and that's it. Mm-hmm. But then during your traineeships, you go to hospitals, you do your traineeships, and then I noticed, well, I want to see the person behind the disease, and I don't like hierarchy. And that's, I think, a bit of the culture in hospitals. So a job outside of the hospital where you're really involved in people's lives, that suits me best. So that is family medicine.
Why is it so important to see the person behind the disease?
Because that's the thing which makes if a treatment works or not. That's how I think. I think context is so important. Like, what do you find important in life? How is your life? What made you sick in the first place? And that's, well, not like here's your medicine and that's it. Well, I'm exaggerating, of course. Yeah. That's not like how people always operate in hospitals, but that's the feeling I remember I got in the hospitals. And as a family medicine doctor, you also see healthy people, which is also really nice. Mm-hmm. Yeah, they're not all sick.
Yeah. Yeah, so I worked at the GP department, right? I think when I just started working there, someone told me, being a GP is very easy. Half of your patients, it's going to pass anyway, their disease, and the other one will die anyway, no matter what you do.
Well, time is an important factor. That's right. Yeah. If you wait long enough, people don't need you anymore. Mm-hmm.
But that's something you say to patients, right? Okay, why don't you come back in a week and we'll see how things go.
It's shared decision making. So I never feel like I decide. Mm-hmm. You try to decide with the person in front of you. And I think people want reassurance a lot of times. So what do I have? Is it something serious? And they don't all want like medicine or treatment. They just want to be heard and to discuss their problems. And then waiting is a very, very important option.
You have to be patient.
Yeah.
Right.
Mm-hmm.
Yeah. Because we always want to if we have a problem, we just want to fix it, right?
Yeah. And I think that's becoming more and more in this society.
Now you're talking to people about climate a lot, and you're busy with this topic. Mm-hmm. And is there anything in your medical training, like any skills that you learned that are useful now? Like you just mentioned shared decision making. Mm-hmm. I can imagine that's something that you can also, we need shared decision making, mm-hmm. right, in the climate crisis.
Yeah.
But are there other examples as well?
Yeah, I think the best example is, we call it, I think in English, motivational interviewing.
Right. Yeah.
So that's asking a lot of questions. What is going on in people's minds? What do they find important? Why do they think what they think? I use this a lot in my work when you discuss lifestyle and healthy lifestyle, or, for example, if somebody wants to stop smoking, you're not going to tell them how to do this. No, first you want to know, okay, so why do you smoke? What are reasons to smoke? What are reasons to quit smoking? Why are you here? What brought you here? What happened in your life? And those questions you can also use when discussing the climate crisis.
And how would you use them?
I think listening, which you learn during GP training, not really, I think, in med school, but in GP training. And then asking questions and not bringing up the solutions immediately.
Right.
Yeah.
So again, you have to be very patient.
Yeah, I think that's not my best quality, but I'm practicing. Yeah. I'm learning. Yeah.
A few months ago, I spoke to Lee McIntyre about his book, How to Talk to a Science Denier. Mm-hmm. It's funny because he mentions, in his book, he writes something similar. That's one of the skills you have to develop when talking to science deniers. And then I'm talking like flat earthers or...
Okay, yeah. Mm-hmm.
I mean, they're also climate science deniers. But is this skill of listening, being patient... Also, I think you have to know yourself a little bit, right? Because sometimes people say things and they touch you personally or emotionally.
Yeah, that happens. And what I always find difficult is that listening and asking questions, it takes time. And you really, you plant a seed and you don't know when it's going to start to grow. Mm-hmm. And sometimes I feel, do we have the time? But then also I don't want to use another technique because then maybe people get angry or they feel like you're saying something which they're doing wrong, and then that can have like a negative effect. Mm. But it is hard. It is hard to bite your tongue sometimes.
Yeah.
Mm-hmm.
And when you're talking lifestyle changes, then I imagine people who want to quit smoking or people who... if they don't start living healthier, they will get a heart attack or something.
Yeah.
Right? Yeah. Mm-hmm. Mm-hmm. So it's a situation where you have to change your lifestyle. Otherwise, I mean, you don't have to.
Mm-hmm. Yeah.
But if you don't do it, there will probably be consequences.
Yeah. Yeah. And the thing is with healthy lifestyle conversations is sometimes it takes months or even years for people to let it sink in.
Yeah.
And then they come back to you, oh yeah, that conversation, okay, I want to come back and I want to discuss further steps. I think it's the same with climate action or climate conversations. You never know when you push the right button or when you plant the right seed.
And when did this seed emerge for you? Did you have that your whole life already, that you were concerned about our environment and nature?
Yeah, I think so. As a child, I remember all my assignments in elementary school and high school. There were a lot about nature and animals and Wereld Natuurfonds, the World Nature Federation. So I always found nature and animals important. But I was eating meat and fish, so yeah, it did something to me. But I think what hit me is, 2.5 years ago. So I live in the south of Limburg. That's the southern province of the Netherlands. And then there was really, really heavy rainfall. And I sing in a choir every Friday night. And I remember that moment when people started texting, well, I'm not sure if we're going to sing tonight because we have to evacuate. And people started sending pictures of their furniture, which they were moving up, and also sandbags in front of the hospital in the city where I live, in Maastricht.
And was it raining or was it there thunderstorms?
So it was really, really heavy rainfall up the river, the Maas River. So the Maas River was about to flood. So a lot of people were evacuated because of flooding, and a lot of parts in Germany, Belgium, and also the province flooded. But the city where I live, I think they said if the Maas River was 2 centimeters higher, it would have flooded. And then the neighborhood where I sing would be flooded, the hospital, the huisartsenpost, so where GPs work after hours, would be flooded. And I remember that for me was the moment which hit me most, because I was very, I made sustainable choices in my life. I bought secondhand clothes. I was really thinking whether to fly or not, what I'm eating. But then I realized, okay, this is a real serious problem, which is maybe more urgent than I knew. And what can I do more?
Yeah, so
that thought.
Yeah, this mindset of what if I connect it to myself. I was also concerned with the environment, and we had this slogan in the Netherlands: een beter milieu begint met jezelf. A better environment starts with you.
Yeah.
So you have to be good. Basically, you have to recycle. You have to watch your lifestyle and everything like that. But you were already doing that.
Yeah.
And it was more about because we care about nature, we have to save the polar bears. That kind of imagery, right? Yeah. But so now, I think this is what people refer to as their oh fuck moment in the climate crisis. Or oh shit moment, whatever. Like, this is real. There's something really going on. And it's,
It was so strange because 2 days later I was cycling through some nature with my husband in Belgium, which is like 15 minutes from where I live. And that was close to the Maas River. And you couldn't see anything happened because the Maas River was still a bit high, but not as high as it was. But there were plastic bags 2 meters up in the trees. So that was how high the Maas River was there. And it was surreal. I never experienced anything like this. Those plastic bags, I think was my oh shit moment. And I'm still, to this day, I'm a bit sad I didn't take pictures of that, because that was my moment. It was surreal.
Yeah.
And you saw also refrigerators like in the fields and campers, because one of the campings flooded, which is super close by the river. And those were just everywhere. And dead fish, and it was crazy. Yeah.
But rivers flood sometimes. So how did you connect this to climate?
Yeah, I think it was the first time in my memory that the Maas was so high, and also a lot of people were talking about it. But of course, rivers flood, but it was, for me, I saw this with my own eyes, and that for me made the difference. Yeah. So it's so much more than seeing a flood on the news, I think. If you see this with your own eyes, then it hits you.
Which we have plenty of opportunities to see now, right?
Yeah, definitely,
New York, Libya, Pakistan, not so long ago,
Italy this summer or in May.
Yeah. I like that was a while ago, but in my interview, Hannah Prince said half of the world is going to be on fire and the other way underwater or something like that.
Yeah. and I feel guilty because I knew how severe climate change was, but it's so stupid that then this needs to happen first for people to become active. But that's how it worked for me.
It's a different kind of knowledge when you see plastic bags in the trees.
Yeah, I think so.
But again, this question, so I'm asking you now, okay, people say, it's very bad, but it happens sometimes. Yeah. So how do you know that this is related to climate? I mean, this specific flooding of the Maas River, how do you know that specific flooding is related to climate?
Yeah. I don't know so I'm not a climate scientist, I'm just a medical doctor. But if you read the scientific papers, you see that the chance of flooding is so much higher than it was, for example, 30 years ago, because of climate change. So the chances that the rivers are high, the chances of heavy rainfall, of thunderstorms, those are higher than were before. Mm-hmm. So we're going to see this again and again and again.
Yeah, and we have seen it already, right? Yeah. I mean, there's a report about, I think this had to do with Maastricht, where they say, well, basically the limits of adaptation are reached. So we cannot, I mean, you can say you have to build dikes or whatever along the Maas River, so it won't happen next time. But even that, and in a country like the Netherlands, where I mean, we'll be fine, right? For at least for a while.
Yeah. We'll see. Yeah, we'll be fine. But other parts of the world, they're not. So that's the. It's an unequal situation.
Yeah. Okay, so you had your oh shit moment, and then what did you do?
Well, I let it sink in for a while. And what I saw is that after a week, I don't think people really forgot the floodings, but it was not really a subject anymore. Like life goes on.
Yeah.
But that wasn't the case for me. I was so shocked and I was thinking about it every day. And then suddenly I had the thought, okay, what can I do more? Which I just said, I'm a healthcare professional. Can I do something in my job? And I was also really frustrated, like, okay, I did med school, which is a scientific university, education, scientific education. I never learned anything about climate change. In my family medicine training, we didn't discuss the subject at all. So I was a bit frustrated, like, this is so important. Why is this not in our education program? Mm-hmm. But also, why isn't this a subject in my work? So I let it sink in and I thought, okay, what can I do? And I just had like one crazy idea. I was in a conference with a lot of GP trainees from Europe. It was in Amsterdam. And we had a barbecue. And back then I was like a flexitarian, so I didn't eat a lot of meat, but sometimes I did, but I chose the vegetarian burger. But there were only like 10 vegetarian burgers and I think hundreds of meat burgers. And this was, I think, 2 weeks after the floods. And then I realized, okay, this is strange. Why is there so much meat in this conference where we're all healthcare professionals. We are all about healthy life, healthy planet, I hope. And so I started to ask questions to people and to friends who were there, like, are you also surprised? And nobody was really surprised. But when I asked the questions, would you mind if the whole conference was vegetarian? And every single person said, no, I wouldn't mind. But now, of course, I'm going to eat the meat burger because I didn't sign up as a vegetarian. And otherwise, I'm going to eat your vegetarian burger. And then I came up with the idea, why do we still serve meat in conferences, in medical conferences? Can we change this? So that was my first idea.
But why? How is this related to climate? Because I can imagine for health reasons.
Yeah.
Of course, I'm a vegetarian as well. Mm-hmm. Not for, I didn't start out to be for health reasons. But.
Yeah. So it was an idea I had and the feeling like this is not right. And so I started to study the subject. Yeah. And then I found the science and it was just much worse than I thought. The impact of especially red meat is super high. Like the amount of water is needed for the livestock industry and especially in cows, and growing soy for the cows, not for people, but for the cows, so we can eat the cows. And then the impact on the world and climate is just so big. It shocked me. I didn't know this. I had this idea, okay, I think it's not good, but let's read into this. And if you want to do something, like if you want to keep your environmental footprint low as a person or a medical conference, then this first thing you can do is just don't eat meat, don't serve meat. For me, this was an idea which I thought, oh, this is super simple. Why can't we just start doing this?
Yeah, and I guess not just for yourself, but thinking, well, if the whole conference does that, there's, at least a couple of hundred people at the conference. Mm-hmm. So that has bigger impact than if you do it yourself.
Yeah.
So you proposed that, and they said, okay, because I've had those conversations where people say, yeah, we wouldn't mind that, we think it's better, and still there's meat. It doesn't really change much. And I've talked to people as well on the podcast that had many of these conversations where they say, yeah, great idea, we should do this. And then nothing happens. So I'm curious, did it happen or?
Well, it did. But like what I did is I started asking around. Like I was never in touch with other green healthcare professionals. So first I found them online. And we had this like small online meeting where I pitched my proposal. And we started building a network. And what I started is I started like writing like a paper, 2 pages with arguments, because I thought I would get arguments to not do this, to not make a medical conference vegetarian. But after a couple of months, I had the courage, and I wrote to the GP conference, like for GP trainees, and the GP conference. So it's by the Dutch General Practitioner Federation, the Nederlands Huisartsgenootschap. And to my surprise, both of them just said, "Oh, that's a good idea. Let's do this." So I never even needed my 2 pages of arguments. And that surprised me.
That's great, because especially when was this?
2021.
Okay.
Yeah.
And are now all GP conferences vegetarian?
Yeah, they still are. I emailed them last year. So, you're going to do an extra conference, and is it still vegetarian? It was a short email. They replied, yeah, of course.
Yeah. But this was for GP trainees, right?
No, this was for GPs.
Okay,
it's actually the GP trainees who next year they doubted if it was still a good idea.
Yeah.
And I think the argument people always say, like, we think it's a good idea, but we're a bit hesitant what the attendees will think and if they will like it. But then I said, okay, well, last year it was good. If you don't do this anymore, it's really a step back. And they did this, and I know for next year it's not even a discussion anymore. It's still vegetarian.
Yeah, so nice. So I'd like to follow this way, how it it was a personal issue for you, and then it became maybe really personal. You start to ask, okay, how can I do something with this professionally?
Yeah.
And so the first step was to connect with others who, also felt the same way, and just to think, okay, I can stop eating meat, but what if we do it collectively?
Yeah.
But obviously it went further, right?
Yeah. So when I started to building this network, I found other healthcare professionals who were also, we call this green, within my GP training. So there's this group, how do you call this? Yeah, the LOVA, you know this, how would you describe?
Yeah, it's like a student, not student, because obviously you're already a practicing doctor, but you're in training for GPs, and you're the organization of the GP.
Yeah, so GP trainee organization. Yeah. And within this organization, there was already a group, like a sustainability group. So I found out, and I thought, wow, let's join. And I think that was where I took my next steps.
Right.
Yeah.
And if you went to your education institute, were they also vegetarian?
No.
No. Okay.
No, not yet.
Yeah. And did you propose the same in your? Because there are of course, there are the conferences, but there's also where you have classes, your education institute. Yeah.
Yeah.
And those are, of course, the teachers, the ones that teach you how to be a GP. But they were still eating meat.
Yeah.
Yeah. Okay.
I think there still are.
They still are. Yeah.
But I know in like the medicine trainees, so the students, I think they're just. Maybe because they're younger, they're more progressive. I don't know. I feel this in for them, but I know that they start to organize more vegetarian lunches. Yeah.
Well, as you know, I worked for the GP training for a long time, and the people I talked to about climate, the experts, they were also almost always much younger than me. Many of them were students. And if there were any initiatives like this, then generally the people who would resist it or block it were much older than me.
Yeah, because it's new for them. And I understand. I don't know how I would think about this subject 10 years ago. I really don't know. And it was also super interesting when discussing the subject within our small online network, like an online meeting when we were preparing for contra-arguments, we were also debating, okay, shall we say no meat? Or shall we say completely vegetarian, so no meat and fish? Or shall we propose plant-based? And of course, the best thing to do for the environment is completely plant-based, also without dairy, like milk products, eggs. But I didn't choose to do this because I was also preparing for those contra-arguments, and I thought maybe if they find me too radical, then they won't listen anymore. Yeah. So I thought maybe just first take the first step, make it vegetarian, and especially no meat. And then when that becomes the new normal, then you can have the discussion about plant-based. Yeah. But this is interesting because there are also people who say, no, you really have to push plant-based because obviously that's better.
Yeah, but in this case, you're not basically doing what you're taught in training, like look at the scientific evidence, how it relates to health and make the healthy choices. Mm-hmm. So you're not just saying, well, actually, we're doing something. We have to make a lifestyle choice as a profession, as an education institute. Here's the evidence. I mean, the evidence is pretty clear. And we could do this thing and it would have a big impact if we would do this with the whole hospital. But you as a young doctor or young doctor in training have to think, okay, but if I say this, maybe I'm being seen as too radical because I'm telling them the science. Mm-hmm. I don't know what to say about that. And I don't want to pretend that this is normal. Of course, we know that back in the 60s and everything, doctors were smoking as well, right? And even when the scientific evidence was there was one doctor in the Netherlands, Dr. Mijnsma, who was being seen as a radical activist because he did his PhD on the links between smoking and cancer. And he was like kind of ridiculed, but as well by his colleagues. So, I mean, is this too extreme if I make this comparison? Because the comparison I'm making is that, well, the climate crisis has major health impacts, I would say even worse than on a national level than smoking and cancer.
I think so. Yeah. I like the comparison with smoking. I think it's a good comparison because that's also related to my job. Yeah. So, it is a good comparison. But it is a difficult discussion because also I think when it comes to food, it becomes personal. It becomes personal. Yeah. That's the thing. Yeah.
I want to take away my meat.
Yeah. So it's a really. I mean, I could talk about this progress and these thoughts of people for hours. Yeah. But I mean, I'm happy that people made those choices, and now looking back 2 years later. There are so many conferences and like workshops who are completely vegetarian or plant-based. I'm not saying it's from me, but somebody needs to be the first one. And actually, I wasn't the first one. There were a lot of institutes who already did this. So I had this also in my 2-pager with good examples. They were not the first one, but but now it becomes more normal, and I'm really happy with it.
Yeah, that's really great. Yeah. I just want to mark that. I mean, because in previous episode we also discussed about why aren't people acting if the science is so clear? Yeah. But then we're speaking about people in general, right? I mean, and you can say a lot about that. But now we're talking about the people whose whole thing is about we're evidence-based and we listen to the science. And even if the science tells us things that, are not according to our preferences or we don't like them, I mean, that's the conversations you have with patients too. I mean, I know you really like smoking, but, if you continue doing it, it's... Those are the conversations you're trained to have with patients, but then it's apparently a different matter when it comes to following the science, as in this case, GP training or something like that.
Yeah, because I mean, our world, it's not a vegetarian world we live in. So everything different from that is seen as radical. Still is. Even with healthcare professionals and institutes and universities, it's a new thing. So you need this minority who starts up and speaking up, and then like this ball starts rolling. I'm not sure if that's an English correct.
Get the ball rolling. Yeah, I think so. Yeah.
Yeah. So that was the first step. Yeah.
Okay. Okay. We got some new coffee and tea.
Yeah.
Very important. So personally, I'm very interested in this idea that, because you can say, of course, as a professional, I have to give a good example, right? So one of the ways in which you could do that is to have vegetarian meals. And if you want to be like sustainable as an organization, I mean, you could make the argument for all organizations. It would be better if they were vegetarian. So that's not very specific for medical professionals. Yeah. Is there anything that you would say about the climate crisis is really specific for medical professionals? As professionals, they have to be concerned with this? Yeah, definitely. So there's a lot of things to say about this. So in the summer of the floods in the south of Netherlands, I think it's also that summer where 200 medical magazines, medical science papers, or science papers, they wrote the climate crisis is a health crisis, a healthcare crisis. And also the WHO, they said the same. Well, they even said so there was a common editorial of 200 medical journals that even said it's the biggest threat
of our century.
That's a different thing than saying, okay, it's better to eat vegetarian and it has health effects, right?
Yeah.
They say it's the biggest threat, bigger than corona, cancer, all those other things that you can think about.
Yeah, it's the biggest crisis of our century, of the 21st century. Yeah, definitely. And I think that's also what was important for me. So I'm a healthcare professional, and there are so many links which I didn't really see before. So many links between the climate crisis and health, which we are seeing now. It is a crisis. And I think that's also an important reason why healthcare professionals need to become involved in these subjects. Yeah.
So what are those? Because generally, when the topic is climate, I don't see a lot of people speaking about health, right?
Yeah.
So one of the things you said about the Maas River is that actually the hospital had to close?
Yeah.
Or am I correct?
Yeah, so it was the emergency department and the GP out of office practice. They shut the doors. Yeah. There were sandbags everywhere because they say, if we're going to flood, please don't come here. And also another hospital in the north of Limburg, in Venlo, they closed as well. So that's like a threat which was seen with your own eyes. The extreme weather events they contribute a lot to health. It's the accessibility of health, but of course, if there are floods, the impacts on you socially, but also mentally are big. And like a small example, in the region where I live, there were also patients who lost their homes in the south of Netherlands, and it did a lot on their mental health, but of course also like stress levels, their sleep, they stop taking medicine, they have other things to worry about. But this is one thing which is where you can see the link with health, but there are so many more links.
Like, for example?
Yeah, it's interesting because one of the things...
Just to, I understand, because for you it's so obvious, right? Because you live this.
Yeah.
And for me, to a certain extent as well, because I was also involved in the GP curriculum with planetary health and everything.
Yeah.
But it's something that is so obvious for us that if I ask you, you say, yeah, of course.
Yeah.
And if I ask you to give one example, it's pretty hard because it's everywhere.
Yeah.
But so people listening to this, they heard this for the first. What the climate crisis is the biggest threat to global health. I've said this a lot also online and everything. The response I get don't be an alarmist.
Yeah.
Don't be ridiculous.
I can't blame people. One of the things I do now is I give a lot of workshops and talks about this subject, a lot to family medicine doctors. And I always ask them, stand up if you see a link between climate change and healthcare. Or I think what I ask them, stand up if you see this in your work. And it's always the minority who stands up. And some of them, they say, oh yeah, I think I see more allergies and hay fever. And then more people stand up. Oh, yeah, you're completely right. Yeah. This summer was really crazy. Like the exponential growth of hay fever. It's crazy. Like even this summer, some medicines were out of stock. Can you imagine you have snot everywhere and you can't work. Some people can't work because they're so allergic. It's horrible. And then the medicines are out of stock.
And how is this connected to climate?
Because of the warmth and more hot summers and hot springs, some of the trees which people can be allergic for the season where they are bloeien, what is the English word?
Oh yeah,
like when there are poles in the air,
yeah,
is longer. So first it was maybe a couple of months. Now the allergy season starts in January.
Right.
It's winter. And then the last couple of years, it starts in January and it lasts longer and it's also more severe. And what I learned is also when the CO2 level in the atmosphere is higher, then the poles, which you are allergic for, they're becoming more strong. So we call this allergenicity. So that goes up. So there are different factors which make hay fever a bigger problem in the last couple of years.
Yeah, that's interesting also because it's these kind of feedback loops, right? Like, okay, the season is longer, it's drier, and also the pollen that are there are also having a bigger effect.
Yeah. And this is a small example which I tell people about because you see this in your personal life. Everybody knows somebody with hay fever, and as doctors, as family medicine doctors, we get overwhelmed by people calling for medicine for this. So this is one example.
Yeah, not yet the biggest health crisis of our time, but yeah, hay fever is very serious. I know that.
Yeah, and people can also. I think when you're severe allergic, it's like working with 2 pints of beer. You can't really work effectively.
You can't function, yeah.
You can't really function, yeah. So that's one example. But also another example is we should not forget mental health, I think. For example, when we have more heat waves, you see rising temperature causes more aggression, and more people using drugs and alcohol, and suicide rates go up. There's this direct link between the temperature and mental health.
Okay, yeah.
Which is crazy.
So not because people are worrying about something, but just because it's hotter.
Yeah, because it's hotter and people get more aggressive. Like I think it does something with your emotions, which become more extreme. And I think what all healthcare professionals can relate to is in heat waves, people die. A lot of people, especially in elderly homes, which, of course, they're more vulnerable because they have heart disease and diabetes and they use medicine. And then there comes a heat wave and it does something with the body. And in heat waves, more people die. Like elderly homes, they lose a lot of people.
Yeah, I saw some figures. If I remember correctly, it was last year, it was over Europe, it was about 16,000 extra deaths in summer, right?
Yeah, I think I read the same, yeah.
One of the things that frustrates me most is that the major news organizations in the Netherlands, it's called the NOS, when there's like a record temperature, they did it again. September was the hottest month, and then you see like people on terraces, and then see... Yeah, and it's like, I don't know, for me, it's like when there's like forest fires where people die and you show a picture of children roasting marshmallows or something. Yeah, of course. I mean, it's now October. I love warm weather. So I love that it's warmer now. But if you have a news, this is just one of the things in the public imagination, I think, that we do associate with warmer weather, especially in the Netherlands. Definitely. Yeah, great. I mean,
yeah, so nice.
But it's great if you're not, one of those people that dies or loses family or something like that.
And it's also, this crisis it's so unequal. I work in 2 practices, and those 2 practices are in neighborhoods where people have like lower socio-economic status. they cannot afford air conditioning. Their jobs they do are making streets, or they stand in the markets. Those professions, they are it's working in those hot conditions. It's super difficult. I mean, I praise myself a very lucky person that I can work in a practice which is isolated or has an air conditioning. But not everybody has this luxury position. And that makes me frustrated as well. And that puts sparks on my fire to speak out on this subject, because it is unequal also in our country.
Climate justice.
Yes.
We had this philosopher, of course, who published an op-ed saying that, it doesn't matter if we go over 2 degrees because we can just all have air conditioning.
Yeah, which world does he live in?
Yeah. Well, he's a philosopher, so,
Different kind of world.
Okay, so you mentioned a few things already. And I think the things you're mentioning are relevant for, you're speaking about now, right?
Yeah.
We're now at 1.2 degrees warming globally, which is in Europe, it's over 2 degrees. And with heat extremes, it's 4 degrees. So it means that the heat wave of what would be now 25 degrees would already be almost 30 degrees standard. Yeah. So that's a big impact. But is that, does it justify to say this is the biggest health threat to our of our day?
For me, it feels like so, and I think if the WHO says so, and if all those scientific papers say so, who am I to say it's not? I mean, it's science, right? I had a scientific education. Who am I to doubt the science? Right. And also, we are always looking at our country. But we are super privileged to live in this wealthy country with dikes and air conditionings. I mean, I worked in Zambia, and I worked in refugee camps in Lesvos. You and I, we could be those people living there. You did nothing to be raised in the Netherlands. The crisis is already going on in the world, in other parts of the world, causing migration, for example, and a difficult life.
So how do you see, because this is 1.2 degrees and we're pretty sure we're going to 1.5 and maybe over. So how do you see this in terms of what do you think is relevant to know for healthcare professionals in that context?
So I think there's 2 things which are important. It's adaptation and mitigation. So first of all, mitigation. So how can you mitigate climate change? What is your responsibility? How, as a healthcare professional, do you contribute to pollution, to CO2 emissions, for example? I think that's one thing to discuss. And the other one is, it's going to be more extreme. How can we adapt? How can we make sure that, the negative effects can be less? And there's a lot of things we can do as healthcare professionals. Yeah. So first, I always tell people, just start somewhere. I started with this vegetarian conferences, and then suddenly it's like you put glasses on, and I call them green glasses, and then you start seeing things which you've never seen. Why did I always do this? For example, in my job, when people have problems with their lungs, like asthma or COPD, those effects are also really seen with climate change, more pollution, more symptoms of breathlessness, and more COPD and asthma. But so the burden of disease will become bigger, and we need to prescribe probably more medicine. But then if you choose the medicine, you can also think about the effects of those medicine. So I never really realized, is there a choice? Is there even a choice for a medicine which is less polluting? And if you choose a medicine, also tell people, how to use this correctly. And if it's not working for you, or if you have leftovers, what to do with those medicine? Because medicine in healthcare are the most the biggest polluters.
And how big do I have to think? Like the healthcare industry, of course, it has, like any company or any industry, it has emissions, waste, everything.
Yeah, it's a good question. So the healthcare in the Netherlands on itself, like if you see the whole industry, 7% of all CO2 emissions or CO2 equivalents is from the healthcare industry. Yeah.
So that's pretty much as big as the aviation industry.
Yes.
So
it's
people
a lot.
concentrate a lot on flying and private jets and everything like that, but the healthcare industry is just as polluting.
It's just as polluting. And then when you zoom in how we pollute, it's medicine. Our medicines are super polluting. First of all, the production process, which is mostly outside of Europe, because it's cheaper there in China and India. It's super polluting there. But then also when it's here, and for example, you have leftovers and you need to burn them or you need to get rid of them, then they come in our water. And then they are super bad for the biodiversity and the whole ecosystem.
That's quite ironic.
Yeah,
I mean, if you're going to use the word ironic, the healthcare industry is supposed to prevent health damage and make people better, right? But if I follow you, they're a major contributor to why people get sick, people die because of heat waves, because of stress, because of pollutants. And I think also, there's
it's a paradox, right?
One of the things where I'm lost for words, because it's like, we've talked about this more. It's a paradox, but we don't have to skip over that. It's just kind of absurd.
It is a vicious circle. So people become sick, and then we give them medicine, which pollute, which make people more sick. So that is the vicious circle and the paradox we're in. And I think it's very important that I think we are trained to look at an individual level. That's very big in like med school. You look at the individual patient in front of you. Yeah. But what I like to do, and I think what is important to do, is to zoom out. Okay, I have an individual in front of me, but what is the effect on a broader level, on society or on the ecosystem? How can I do the best for both? And I think that's super important. So I would never give you, Mario, bad medicine. But I think in the back of my mind, I always have the impacts on the environment. And then sometimes I discuss them with patients, especially with lung medicine. Like when you're a child, there's not much to choose from because there's only one inhaler you can use as a child, because your eye-hand coordination, when you're 3 years old, I cannot tell you, breathe in now and hold your breath. But when you're past 7 years old and you become a teenager or an adult, then there's this whole variety of medicines you can choose from. And a lot of them are like 15 times less pollutant. And people don't know this, and a lot of doctors don't know this. But that's a very big impact you can have when you make such a small decision to choose for a different inhaler.
So that's the same kind of thinking why you don't just prescribe antibiotics to everybody, because maybe it will help this individual patient get better soon, but it also means that there's more resistance to, or more resistance.
More antibiotic resistance. Yeah.
So what do you do with this knowledge? I think you're giving workshops and teaching your colleagues, basically.
Yeah. So when you join this, like, is it climate movement or well, let's call this climate movement. I just found out that there were more healthcare professionals who were struggling with the same. Okay, I am polluting, and this is a healthcare crisis. And what can I do? How can I contribute? And this movement is growing, and so within my work field, now I graduated as a general practitioner, and I'm part of like the Green General Practitioner, the Groene Huisarts, and we see like, okay, how can we talk with with organizations within our fields. How can we make our pension funds divest from fossil fuel subsidies? But also, how can we teach our colleagues? Because you don't know if nobody told you.
So because you say the pension funds of GPs,
GPs
invest in fossil fuels?
Yeah, like still 75 million euros each year.
Right.
Yeah.
Which is the major driver behind climate change. That is the biggest health threat of our time.
Yeah. So that's
found another irony.
So that's those green glasses you put on. Like I never thought about the effects of my pension funds or my money. And when you are becoming more and more involved in this subject, suddenly you see things you never saw. And one of the things I do is as part of the Green GP, but also the Green Health Alliance, so the Groene Zorg Alliantie, which is like a big organization where all green healthcare professionals can be part of. I'm an ambassador for them. And as an ambassador for them, I give workshops and talks on conferences, you name it. You can ask me and I'll happily come to you to discuss the subject.
And how do you approach those workshops? I mean, and specifically you're talking to colleagues. Okay, there's of course the content where you say maybe you don't know that the climate crisis is the biggest threat to global health, and here are the facts, and that's it. Of course, you could put that on a PowerPoint, right? So maybe that's the question. Like, what else do you do besides putting the information on the PowerPoint?
Well, to be honest, it's still a learning progress. I started doing this, I think 1.5 years ago. Before, like for my own colleagues, I was still a GP trainee, and that was my first workshop. I did like a summer school for my own GP trainee colleagues, and I started with facts, a lot of facts, and I thought that was the thing to persuade.
Show them the evidence.
You have to have a discussion. So I always start with questions. So, okay, which sustainable choices do you make in your personal life? And then you see everybody stands up. Oh, I have solar panels, or I eat vegetarian, or I fly less. And then I ask them the question, but what do you do? Which sustainable choices do you make as a healthcare professional? And then you see people thinking like the same thoughts I had 2 years ago after the floods. You see people thinking, oh, it's actually really strange. I do so much in my personal life, but I never thought of sustainable choices as a doctor.
And again, if people think about flying less because the aviation industry is so polluting, and you work as a doctor, and the healthcare industry is just as polluting as the aviation industry. Yeah.
And of course, I mean, I also make that comparison, but it's important to say that a lot of aviation is as tourists, and it's not like your basic need in life, and healthcare is. So the comparison is good, but also the difference is that we are basic, and I mean, we cannot shut down healthcare, but we can think in terms of, okay, how can we do better? How can we damage less? So if we go back to 7.5 years ago, when I graduated from medical school, I made this Hippocrates oath. You know, we say primum non nocere, which means first do no harm. And that's the paradox. We do harm by providing healthcare.
That's a paradox indeed.
Yeah. And so, and when coming back to my workshops, I give them information like, okay, the impact of medicine, which choices can you make? I think a big part of the workshop is also healthy lifestyle. Because if we invest in prevention, and if we have those conversations about healthy lifestyle, we can prevent people from becoming sick and needing healthcare and needing medicines. That is the biggest impact you can make.
Yeah, if you don't take the car, you pollute
For
less.
example, yeah.
But you're biking, you're healthier.
Yeah. Mm-hmm.
You don't need heart medication later on.
Yeah.
You don't need a surgery, which is, I think, one of the most polluting things you can have.
Mm-hmm.
Yeah.
Mm-hmm. Yeah, and there's when talking about healthy lifestyle, there are only advantages. There are literally no disadvantages if you choose to start making healthy choices. It's good for almost everything. For yourself, on an individual level for your family, but also for society and our planet.
Yeah, and just to repeat what you said earlier, the issue of climate justice, right? Like the how do you call it? Intersectionality. So like I think in general, women have more somewhere. I don't know how much, but in general, but so if you're a woman in like a low income neighborhood with a lot of concrete everywhere, so your neighborhood doesn't cool down in the night, but you also can't afford air conditioning, and you rent a house, which is also poorly maintained and everything like that. And then a man in like a lush neighborhood with a lot of green who also has an air conditioning. And I think those are all across the boards, like all these differences that you pay attention to as a healthcare professional.
Yeah. That is one of my biggest drivers, that unequal systems, and also the way climate change hits people in an unequal way. It's always the vulnerable people, children, women, people of color, queer persons. They're always more vulnerable.
Okay, Plato's Cave.
Oh, yeah.
Yeah. So you're a doctor. I know, because I know some promotion I wrote 2 books on philosophy in medical education. So I think I really like the link between philosophy and doctors, because, doctors and philosophers are groups in society who voluntarily think about things like that and suffering, dilemmas and all those other things that most people in society don't really think about too much, because why would you think about it? It's not nice. So I want to ask you I'm curious how you see this story of Plato's allegory.
Yeah. So, okay, I have to be honest, this was completely new for me. I always feel a bit stupid when it comes to philosophy, and I'm just a medical doctor, but I found it so interesting when I read into this, and I think you told me like there are still people doing their PhDs on this allegory.
Yeah, exactly.
Because you can see it from so many parts. And when I read the story, the first thing that came up to me was I felt like this person living in that cave before the floods. Like I thought I knew everything about sustainability and sustainable life, but I didn't see how I could have an impact as a healthcare professional. Like, I think it's also the system where you are raised in and educated in. They want you to see like the system as it is now. There's no other way. It is what it is. We need fossil fuels, and we need to be doctors on an individual level. And climate change, it's happening. But what can you do? Yeah, maybe as an individual, but we cannot change the system. And then you turn around. So I'm that.
That's the oh shit moment.
Yeah, that's the oh shit moment. And then you're in that cave looking at all these shades, and you think, okay, this is the world. And then you put on those green glasses and you become unchained. And then you turn around and then you see the real world and how it can be, and how you are free to have discussions and to criticize the system, because you live in a democracy and you have free choice.
Yeah.
That for me is Plato's.
Right. So also your agency, that you don't just have to follow what people are used to doing, but you're not a rebel or something like that. Okay, maybe also. I take that
What
back.
do you mean?
So we have to go from proposing a vegetarian lunch to you getting voluntarily arrested.
Yeah. Yeah.
But so what I wanted to say is that you realize that as a professional, there's a lot of things you can do. Yeah,
definitely. Yeah. On different levels. Yeah. So as a healthcare professional, as an individual, as just someone having a pension fund, you can criticize the system. Yeah. And I really, really, really believe you can change the system.
Yeah, I read somewhere that GPs are in the top 5 of the most people believe most about climate change, right? So I think even if you're saying to someone, I mean, if I'm talking to someone and you're talking to someone, you say, yeah, you know, I'm a doctor. And I think that already makes a difference, right?
Yeah, you're right. If you ask people like who are most credible, I think the librarian and then the doctor and the nurse are always in the top 5. And that for me is also a big driver. Like, okay, who am I to do this and to give those workshops and to speak out also on like, for example, social media and in your podcast, is because apparently doctors are credible. So if they speak out, people listen. And you really see this shift also in politics since doctors started speaking out also on climate change. You see like almost people's ears in politics move like, oh, okay, doctors speak out, then it must be an important topic, climate change. Then it must be something big, which is ridiculous. But if it works, yeah, we're happy to speak out. And that's why I urge all healthcare professionals to speak up.
Yeah, great. It's also the reverse. If some people are saying we're in a crisis, but the adults in the room are silent, yeah, I mean, how bad can it be, right? Yeah. So in politicians, they don't act as if we are in a crisis. So then maybe we should act as if we are in a crisis. Yeah. And so far, just to be clear, so far healthcare professionals are not acting like they're in a crisis.
I think the majority is not. I think what gave me hope 2 weeks ago, I was at a festival of the Green Health Alliance. Last year, there were 150 professionals. And now it was, I think, almost sold out, over 700 healthcare professionals. And in 1 year, you see so many people start moving and take steps within our profession and speaking up publicly about climate change. That's super hopeful.
Yeah, it's great. So healthcare professionals are starting to listen to the evidence.
Yeah, definitely.
And still the biggest threat to public health of our times, would you say it gets the biggest amount of attention?
No, definitely not. I don't understand, because when you look at the corona crisis, you saw that we can make a change. Like whole schools and practices were shut down. People were acting like in a crisis mode. And I think that for me is the evidence, okay, we can change drastically. It's just a choice you have. And people are now not making that important choice to change the system drastically.
Yeah. Do you want to talk about your wedding, or is that too personal? Oh. Because I think it's a great story. Yeah,
no, I'm fine with talking about. I mean, it was the best day of my life. So yeah. What do you want to know, Mario?
How green was your wedding?
Yeah, so I think with all choices you make, of course, not having a wedding is how not having any environmental impact is the best thing to do. But of course, we wanted to marry. Me and my husband 1 year ago, and we just chose to, like, in all steps we made for our wedding, to make for our what we thought was the best choice to make. So there was never a doubt making it vegetarian or not. It was almost completely plant-based. We had some chocolate and some cheese, but for the rest, it was completely plant-based. We chose a location who does like all they grow their own vegetables, and it's like a permaculture. So it's a whole, like, I think a circle way of agriculture. We chose a place which was accessible by public transport. Even my dress. Okay, I wanted a second-hand dress. I didn't find a second-hand dress, but I found one which was made like in a sustainable way. Like they recycled the water, they made it in Europe. So I'm sure like it's not like child labor or super polluting industry. And then I chose one which I can wear more. Like it's a top and a skirt. Mm-hmm. And the top I still wear.
Yeah. So that's why you're in your wedding dress now.
Yeah, I wear it every day now. And the skirt I gave back so she can sell it secondhand to people with less money. Yeah, and my husband he chose a suit which he can still wear and which is made in Belgium in a sustainable way. So it was super fun to do it this way and to, I hope, maybe be an inspiration for others. Like I wrote on LinkedIn about it and I got 75,000 views, which is very interesting.
It's so nice because it's now, for me, a new example. And it's a happier example because my previous example was a funeral.
Oh.
Because you also have this Dutch guy who invented like a mycelium-based coffin. So it kind of decomposes your body. And it's because apparently putting coffins in is also very polluting, and burning people also has emissions, right?
Mm-hmm.
So... But I also think it's nice because besides the impact, it's also kind of a social impact. Like people start to talk about it. It helps people put on the green glasses, right? Mm-hmm. Yeah, nice. So, and how long have you been married?
Now, just over a year.
So you just had your anniversary.
Yeah.
And where did you spend your anniversary?
I spent my anniversary on the A12, so it's a road in The Hague, in the climate protest of Extinction Rebellion. Mm-hmm. Yeah.
Yeah. So you got your husband to go along with this, or is he also?
Yeah, so I think he's my biggest support, but he's not an activist like me. So, but he supports everything I do. Like when I have a potluck dinner with Extinction Rebellion in my city, and I don't have time, he makes this vegan salad which I can bring to the potluck. But also he is a supporter of the demonstrations I go to. Yeah, maybe not as an activist as me, but not everybody has to be. We need supporters as well.
Yeah, great. So, and I know many, so the Extinction Rebellion has the community group, Extinction Rebellion Healthcare Professionals, right? So,
definitely, yeah.
They're very nice photos because I think one of the photos I saw is your, how do you say that? Resuscitating the earth?
We did CPR on the Mother Earth.
Mother Earth, taking turns and everything like that. And you're there in your white coats. Mm-hmm. But how do you feel about, because there's also critique because they're saying, well, okay, if you go there as a private, basically you're breaking the law. Mm-hmm. If you go on the road, I don't know if you did that, but there are healthcare professionals who do that. You go there in your white coat. So, it's an important issue, but the law is the law. So how do you feel about going there as a professional?
Yeah.
Or do you say, well, I'm not there as a professional, I'm here as a private person?
Oh, that's interesting. So wearing the white coat with our Extinction Rebellion healthcare professionals logo, I think you cannot say I'm there just as a private person. I mean, you say I work in this field, and we do this to let people know that also we as doctors and nurses and psychologists are very, very, very concerned about the future of the earth and also about climate change. So we unite because that is really a nice thing to do. And then we say, okay, we're so concerned that we even chose to block a road in the city. Yeah. Mm-hmm. And breaking the law, I think it is within the right to demonstrate, to do this within sight and sound. So it's an important place in The Hague to demonstrate against fossil fuel subsidies, because that's what it was about. I'm there as Margarita, but I have this sign which says, deze huisarts maakt zich zorgen. So that means this family doctor is very concerned, and it attracts people's attention. Yeah.
Yeah, because those fossil fuel subsidies make it easier to emit CO2, and that causes the health crisis.
Yeah. I'm just concerned about the decisions politicians make, because apparently they find lobbyists and these very, very polluting companies more important than our health, than your health and the health of my patients. Like there's 4 billion euros every year going to family medicine, or how do you say this? And then over 40 billion euros a year to fossil fuel subsidies. I don't understand.
I don't understand either. Yeah.
So that's why I demonstrate. Yeah. And I never thought I would do this. But I think it's important. Like we can sign petitions and we can walk in climate marches, which is very important to do. But it didn't bring us what is needed, like radical change. So we need radical measures to get radical change done. And if that's blocking a road, then let's do this. So be it on my wedding anniversary. Mm-hmm.
But I talked to you a couple of months ago, I think, and then you said, I go there, but there's like different gradations. You can be in the support demonstration, or you can go on the road, and then basically when the police tells you, okay, if you don't leave now, we'll arrest you, you leave. Mm-hmm. And then there's a next one where you say, well, I'll stay there even if I get arrested. And I think a couple of months ago you were saying, I heard you saying that you go there, but you're not in the place where you get arrested, right? Mm-hmm. But then later you told me, you got arrested.
Yeah.
So tell me, how did this...
Things escalated quickly.
Again, something we shouldn't step over. As a healthcare professional, to make the choice to voluntarily get arrested by the police, and in your profession as a GP, you work a lot with the police, right? Yeah. So they're kind of... Mm-hmm. That must not have been easy for you to make that...
No, choice. So I really thought about this, and I think when the blockade of the road started on 9 September this year, I chose not to get arrested. So I was on the road a lot with like over 10,000 people, and we're doing CPR on Mother Earth, and we do this for 4 hours. But then when the police came closer, and also because my husband was there, I was so happy he was there, I chose not to get arrested. So I stepped off the road.
Not get arrested on your anniversary.
Yeah, I thought, that's a shitty end. Let's just go home and have nice dinner. But then a couple of weeks later...
so they blocked the... I should say this because the previous episode I talked to with Anne Kervers. Mm-hmm. Well, she's in Extinction Rebellion, and she was talking about then the plan was to block the road every day, starting the 9th of September. Yes, and I think they've blocked the road for 27 days.
27 days in a row. Mm-hmm. And every day in 12 p.m.
And now there's going to be a vote in the parliament on a motion to stop fossil fuel subsidies. Mm-hmm. So now that's the reason they stopped, is because actually, basically it worked.
Yeah, because politicians are listening.
Well, I won't say it worked, but there's going to be a vote on it. And they said, okay, we're going to take a pause and wait what the outcome of the vote will be. And then we'll decide if we continue or not. Mm-hmm. And if we're not happy with the vote or anything, then we'll start blocking again.
Yes, yeah.
But 27 days of peaceful protests with no violent actions from the protesters. Yeah, I don't know if I asked around, are there historical examples of this in the Netherlands? I don't know. Maybe someone listening to it can. But I just wanted to mark that as well, because that's quite special. Isn't
it amazing? Yeah. It's always in a peaceful way, what you said, and I think that's why I also chose to be part of this, because I'm not a violent person. I don't want to break the law. I want to work as a healthcare professional. But if I can change the system in a radical, peaceful way, that for me was the thing which made me make the decision to join those protests, the blockage of the road. And 2 weeks later, I got arrested.
Yeah, so... Maybe the last question, because if you're studying climate science, you probably didn't study climate science before,
No.
Mm-hmm. So that happens with a lot of people now, right? You start to learn, you realize, there's a lot I need to learn. It's really complex. Obviously, you know how to read scientific papers and everything like that. Mm-hmm. But it doesn't really make you happy, right? If you look at what's happening now already, that's one thing. But also, where are we heading? And also of course, even the healthcare industry doesn't realize that we're in a crisis and isn't acting on. How do you have hope, or how do you feel about that?
Yeah. I think it changes. It can differ from day to day. Obviously, like all normal emotions can differ. What gives me hope is the movement I'm seeing now. So if we go back to the floods, I really felt a bit alone. Like 1 week later, nobody was talking about it, and I was still processing everything what happened. And then suddenly you come across other people who are also have the same concerns as you have. They speak out, and they are also in the same. They have the same feeling like, okay, I'm just one person, but let's try to change the system and the world, and also the healthcare system. And now there's so many people who try to do this, and I think that gives me hope. And I mean, to be fair, we need to stay hopeful. I think we need to, because otherwise we burn out. And I think that is that hope keeps me going. That hope of uniting, seeing people and systems moving. Maybe not as fast as I would like to see them moving, but there is progress, and that brings me hope.
Thank you so much for speaking with me in your old science park.
Yeah, thank you, Mario. It was really nice speaking about this. Thanks.
Thank you for listening. You know, a lot of coffee goes into producing this independent educational podcast. If you want to support me with the towering cost of this coffee, you could subscribe to my Patreon for only €1 per month, or make a one-time donation. It also helps if you subscribe on your podcast provider and give a rating, because that's how it works in Plato's Cave. Go to livefromplatoscave.com for more information.